Good afternoon, everyone. We will be getting started in just a few more minutes. We're going to allow for more attendees to join the call. Good afternoon, everyone. I'm JB. I'm the Dean of Students here at CU Boulder. I will be moderating today's call. Some quick housekeeping items before we get started. All attendee lines will be muted throughout the call. When we get to Q&A, place your question in the Q&A function at the bottom of your screen. We will do our best to get to all questions. If we do not get to your question, you can reach us at the colorado.edu/COVID-19 website. And as a reminder, today's call will be recorded. This recording will be added to our COVID-19 website. Joining us today as panelists are Chancellor Phil DeStefano, Chancellor, Provost Russ Moore, Interim Chief of Operating Officer Patrick O'Rourke, Executive Director with Boulder County Public Health, Jeff Zayak. We are also joined by Ann Smizing, CU Executive Vice Provost for Academic Planning, Catherine Irwin, CU Chief Human Resource Officer, Katrina Spencer, CU Associate Vice Chancellor for Budget and Finance. Also, Dr. Jennifer McDuffie, Associate Vice Chancellor for Student Affairs, Health and Wellness. Shannon Alaba, Communications Manager with the City of Boulder. And also, Dr. Chris Urbina, Medical Officer with Boulder County Public Health. Now I will turn it over to Chancellor DeStefano for some opening comments. Chancellor.
Thank you, JB, and welcome everyone. With a few weeks remaining in the semester, I've been reflecting on this year, the setbacks and the challenges, the resiliency of this institution, and the fabric of our community. I am deeply grateful to the city and the county of Boulder, along with all of the organizations and people who have worked with us this year to help us remain open. I want to say a special thank you to the staff, our scientists, and other CU personnel who've worked tirelessly, brought forward innovative ideas, and together have ensured our campus, classrooms, dining facilities, and community remain safe. At CU, we've always focused squarely on the health and the safety of our community. This has involved a lot of work behind the scenes. It was a tremendous effort by some of the most talented and dedicated staff and faculty I've ever had the pleasure of working with. A lot of the dramatic changes we have made were born from short-term necessity, but they will live long beyond the pandemic. We carry new lessons learned for today's and tomorrow's buffs. We need those lessons because the challenges are only growing and the stakes are getting higher. We can't let our guard down now. We know that many students will remain in the community during the break, and they must continue to remain physically distant, wear masks, get tested, and isolate if COVID-19 is positive. And we at CU will work tirelessly with the city and with the county to plan for a safe and healthy return in 2021. We will redouble our efforts and our commitment to our mission to shape tomorrow's leaders in the healthiest and safest way possible. Before taking your questions, to our students, to our faculty, staff, parents, community leaders, public health experts, and all those with CU and Boulder's best interest at heart, I want to say thank you. This was a community effort, and it will continue to be going forward. Now I'd like to turn it over to our Provost, Russell Moore.
Thank you, Chancellor, and thank you everyone for joining us today. As many of you already know, COVID transmissions are on the rise, both in the state of Colorado and including Boulder County. Seeing the cases rise like this causes us great concern, and it's imperative that we all do our utmost to take care of ourselves and each other. Here on campus, we're continuing to prioritize the health and safety of our whole community while actively striving to support our students, staff, and faculty as they persevere in their individual and collective pursuits. Our decision to shift classes to a remote learning mode last Friday, a week ahead of our previously scheduled shift, is one such decision. While this shift can feel like another disruption in a year defined by disruptions, it allows our students and their families the flexibility they need to leave town, travel safely, and finish the semester strong. I, with the Chancellor, urge our students to take advantage of our expanded testing capacity and to get tested, as well as to follow quarantining protocols should you test positive. I know this time of year presents a multitude of challenges. Even when we're not experiencing a pandemic, the end of the semester can be a stressful time for many. I encourage our students to tap into resources that CU Boulder provides to help you finish this semester successfully. Please connect with your academic advisors, with counselors and CAPS, with the Writing Center, and with tutors and coaches. Without a doubt, this semester presented many unforeseen challenges, yet I couldn't be more pleased at what we've accomplished together. Our students, our faculty, and our staff have done an incredible job, and I want to thank all of you for your sacrifices and for your outstanding achievements. I'll now turn this over to Pat O'Rourke.
Thanks, Russ, and thank you to everybody who's tuned in to join us today. Doing these meetings throughout the course of the semester has been really important. The opportunity to hear from students, families, faculty members, staff through these webinars has given us a lot of insight as to what you're thinking and provided an opportunity for us to improve. So thank you for joining us, and thank you for continuing to give us your feedback. As both the Chancellor and the Provost mentioned, we're really concerned about the rise in COVID cases, which is not just happening here in Boulder, but across the state and across the nation. The rates of infection have continued to rise, both in the 18 to 22-year-old community and across all age demographics. Boulder County's number of cases is now deeply in the red and is continuing to increase. So even as we complete in-person instruction this semester, and many people transition back to their families and to their communities away from Boulder, there's a couple of important things to remember. First, for every CU student, faculty member, and staff member, please get tested before traveling. When you're living in a residence hall or in a house off campus, if you get COVID, your roommates are less susceptible to serious illness than your parents are, or that your grandparents might be. And so getting tested allows you to show that you care for their health too. JB will have some more information in a few minutes about the testing. For students who are living in the community and for those who are returning home, please remember that in-person gatherings are the greatest source of risk for COVID infection. There's been a lot of articles lately that it doesn't have to be a large gathering to spread infection. Getting together with just a couple families or a group of friends creates the possibility to spread infection. And although large gatherings pose a really unacceptable risk, we're counting upon everybody to take the right measures, even in those smaller settings, to help keep community infections in check. And finally, even when classes move to remote instruction, the standards of conduct remain the same. When people violate public health orders or place their communities at risk, we will continue to address that through the student conduct process. You've made it this far throughout the semester, and don't let up on doing the right thing, even though we're finishing the semester remotely and we'll be taking finals remotely. We're going to continue to maintain our testing on campus, even after people head home, to ensure that our students who are still in the community, staff and faculty, have the access they need to that testing capability. And on the COVID-19 website at colorado.edu/COVID, you'll find resources and guidance on traveling safely. For our students, faculty, and staff who have children, we recognize that the recent shifts to remote learning in the Boulder Valley School District and other school districts represent a challenge. And please reach out to your HR liaisons if you have questions about the resources that are available. Very shortly, we may receive new public health guidance. And in fact, we know that the governor has scheduled a press conference contemporaneously with this call to be able to brief on some updates. Jeff Zayak from Boulder County Public Health will talk about where we are and what we expect in the next few minutes. Whatever changes occur, we're going to take a look at them, be able to analyze them, look at what they mean for the CU community, and then be able to communicate to our faculty, staff, and students as we can about what their potential impacts are for the campus. In closing, I'd like to say that I'm really humbled by the dedication, determination, and perseverance that everyone in the CU community has shown this semester. It's been challenging, and I know that I speak for both myself and the provost when I say that I'm proud of the way our community has shown up through the challenges, and I know that we're going to be able to emerge from this stronger. Now I'll turn it over to Jeff Zayak with Boulder County Public Health for him to be able to give us an update from his perspective.
Thanks, Patrick, and thanks again to all of you who are tuning in today. Much appreciate. Again, I want to just start off with how much I appreciate the partnership with the university. We would not have been able to accomplish where we are together today without their partnership and the partnership of the City of Boulder. And we'll continue that, as Pat said. Even though we have students going back, we do want them to go back safely, so please do get tested. And we will continue to monitor the activity that occurs for students who are here throughout the time frame where students are back. So again, just appreciate the partnership. It's been great. Appreciate these sharing sessions, and I hope it's been useful to parents and students and staff that are on the phone listening today. I'm gonna share my screen and go over just a few data slides so I can give you the latest update on where we are. Someone on the phone can tell me that you can see that. I will get started.
We can see it.
Thank you. So as I reported to you the last couple of weeks since then, this is the incidence map, the 2-week cumulative incidence rate by county across the state. And unfortunately, the counties that you see in red, which are now the majority of counties in the state, are counties that are in the highest incident rate category, which on the dial here is stay at home. And unfortunately, that's just been getting worse. I don't have a lot different message than I did last week. And it, again, is going to come down to us individually making decisions like Pat just talked about. But you can see that the majority of the state at this point are in very high incidence rates of cases, and that is continuing to increase. This is, again, the metro Denver region. Boulder is in the red down here. This was our highest peak with CU, so we are already above that. We can only hope that this little tiny downturn continues, but we can't guarantee that at this point. We really need to be looking week after week to see if we have a true downward trend. And this next graph is really going to illustrate the significance and challenge. So this illustrates, and this is our 5-day average of number of new cases, but you can see from the beginning over here, the trajectory line that we've had. This was our highest peak when just after CU came back. And you can see now where we are. We're actually above where we were in that peak. And if you think about the graph I just showed you, some of those counties were significantly higher than where we even are at right here. So we do have a real challenge, and we have a real challenge at a statewide issue to control the spread of this disease at this point. This is our graph of, and we shortened this to a month so we could see it better, but this is the graph of cases. Dark blue are cases across our community that are not CU affiliated folks, and the light blue is CU affiliated folks. So we did see in the last week a little bit of a spike around University of Colorado students. And we are hopefully, again, considering, I would love to be able to see this trend continue down. And this is a partial day reporting. That's why that number is low on that 16th of November. So we would expect that to go back up a little bit. The biggest, again, message here is we're continuing to see increases amongst most all age groups. We are starting to see a little bit of a downturn in the 35 to 45-year-olds, but we are seeing a generalized increase again in most cases across our county and across the state. And that is the challenge that still exists in front of us. We have heard from our epidemiologists that we are seeing, and we're not able to see, because we're not able to contact trace all of our cases. I'll talk about that a little bit more. The ones that we are able to get to, we are seeing the associated spike in cases that were happening over this last week, associated with many of the Halloween gatherings that occurred. So again, messages that when we get to these times when we know are culturally, we do get together and gather, and it's been a very important part of all of our lives. Now is the time to stay away from that. Now is the time to not go into gatherings, to take this year to really make sure we're limiting the spread of the disease, and hopefully to save people's lives by doing so. This is our hospitalizations in Boulder County for COVID-19. You can see that even with a little bit of a downturn that we've had here, we're still above the highest point that we were in this entire disease progression from the start of the disease. So we still have a pretty big challenge in front of us. We don't want to see hospitalizations go higher. We want to drive this trend down. And we are at, as I said last week, we're at a significant critical time right now. We're seeing cases increase. Instead of that estimated 1 in 100, that was last week's data. I got an update today that we are an estimated of 1 in 93 people in Boulder County. In the state that's infectious at this point. Those numbers range between counties. They are now starting to do predictions specifically for counties. So when you look at Adams County or Denver, they're well below 1 in 100 persons infected. So again, the biggest concern that's really the challenge in front of us is that we have so much virus in our community and so many people infected in our community. Really, the only way we can stop the further spread of this virus is by reducing gatherings. That is going to be a key component as we move forward. And we know that that's going to be critical and has been critical up to this point. Again, when we look at, as an example, in-class transmission versus out-of-class transmission, and this is true for our schools, our K through 12 schools, as well as the university. We're not seeing the transmission happen as much in the classrooms, very low comparative to what's happening out in the community. And again, that's because there's so much virus in the community. People are relaxing. They're tired, COVID fatigue, again, big deal right now. People are sick and tired of it. And that relaxation is causing the spike and spread in this. The one thing I wanted to talk a little bit more about this week that I haven't talked about in the past, because I think it's so important for everyone on this call to understand this. If our hospitals get to crisis care standards, what that means is that if you have two people who come into a hospital, they both need to be on a ventilator, as an example, and there's only one ventilator available. The hospital has to make a decision who gets that ventilator and who doesn't. The chances of somebody dying that's not on a vent are much higher than somebody that is. So that's the kind of decisions that this comes down to when you hear the horror stories about what's happening in other countries, or you heard about what was happening in New York in the early part of this disease outbreak. That's how it's impacting people in the community. It's horrible, and we don't want to have to be in those kind of places. That's too late. That means that we failed if we are putting people's lives at risk in those kind of scenarios. And if we don't turn our rates around, we're approaching those kind of scenarios. So please take this seriously. This disease is real. It can have impacts. We know that hospitalizations occur from 30 years old and up. And when we look at our hospitalizations, we actually see our highest rates of hospitalizations in that, again, 50 to 65-year-old group. And we know that the greatest impacts in terms of acute impacts like death are happening in our oldest category. So please take the virus very seriously. We need to take action now. And again, this is gonna come down to those individual behaviors that drive the outcomes. There is hope. I'm sure that you've all been hearing about and seeing about 2 potential vaccines. We do expect that at some point by the end of the year, that we will likely get some vaccine to start distributing to our highest risk populations, like our first responders, our long-term care facilities, people who are at most risk of contracting the disease, with more distribution occurring throughout the first quarter and the summer. So there is hope. We have to get through some months ahead of us. And we don't know exactly what the vaccine will do when it's out in a large percentage of our community. So the effectiveness, as an example, is based on the studies that they've done up to this point. Often effectiveness can get updated as they start to see the vaccine out with a lot larger groups of populations. But we do have hope, and I want to drive everybody to remember that we have hope, and we just need to keep and stay diligent between now and the time that we get to that point. So again, thank you for all of you who have tuned in week after week. Thanks for the partnership, and together we can get through this. I'll stop there.
Thank you, Jeff. As always, I appreciate the insight you share, and certainly we can and will. I want to share a little bit of a dean's list with all of you today. For students who will be traveling, getting tested before traveling and leaving Boulder for the semester is crucial to helping prevent the spread of the virus and to protect the health of our Buff families and friends. With increasing rates across the nation, it is critical that we all do our part. And Jeff mentioned it just earlier. And I'll also mention how important it is, as I've had a family member that has been deeply impacted by this. And so I know how important it is. And certainly I'm behind these messages of let's do it together. Testing takes about 2 minutes, but makes a significant difference. We strongly encourage students to complete monitoring test appointments this week and 48 to 72 hours prior to their departure at any one of our on-campus monitoring sites. For students who live on campus and test positive, isolation spaces and support are available. For students who will be traveling on campus over break. On-campus residents who have a break contract can stay in their residence halls over break. These students will have dining options available to them and will receive specific communication about where to eat over break. Supporting students through the rest of the semester. Some student affairs departments will have adjusted hours and services from November 25th through the end of the year. We will start to share this information later this week, so please stay tuned. With finals around the corner, we're here to support students and help. Help them make good decisions, help them make good choices, and to stay safe. There will be some virtual events and programs to help students take breaks, de-stress, and stay connected. Now I would like to open it up for Q&A. If you have a question, please feel free to enter it into the Q&A function at the bottom of your screen. We are prioritizing questions from students and families. Let's begin with questions. This question is for you, Pat. My student is planning to leave on November 25th. Will students be able to get an individual, not batched, exit test prior to leaving before Thanksgiving? How quickly will results be available? Pat? Or Jennifer?
Yep. So student would be able to get a test. And generally those results are available within 24 hours after the testing occurs. Most of our testing is the RT-PCR, which is the saliva-based test, and that is a batched test. Our sensitivity rates on those tests have been high. If for whatever reason the student or the parent didn't feel comfortable having that type of test performed, Jennifer, would there be the availability to get a PCR test separate outside of the RT-PCR at Wardenburg?
Dr. McDuffie, I don't know if she heard that. You were asking her a question, Pat?
Yes. So I do believe that is available, and that student should be able to request that at Wardenburg. And if for whatever reason, although I don't think that it's as good of an option for students, there is also the community testing sites that are available at the Stasio and Boulder County Fairgrounds. But we're strongly encouraging people to use our own testing resources first, so that we don't place additional demand on the community resources.
Thank you, Pat. Russ, this question is for you. How would a shift to stay at home or something like it affect class modalities?
Yes, so moving into the spring, we'll be pegging our campus mode of operation to the state dial. We are working with the county and the state to be more specific about what changes in modalities would occur as we shift from one state to another state. We do understand that things are looking like they're getting worse. But what we hope to do by pegging our mode of operations to the dial is to provide more predictability for students, as faculty and staff and families, so that they can anticipate possible changes in modality. We're working out the specific details on what pegging to the dial actually means operationally, and we hope to have those information for everyone by December. And again, this is a work in progress because we're encountering things we've never encountered before.
Thank you, Russ. This next question is for me. How will CU be caring for students who have to remain on campus through fall break? We will continue to care for our students, and that's our number one priority. As I mentioned in my opening remarks, there will be offices still available and services still available to students. We will have abbreviated programs and opportunities for students to continue to engage. Certainly there will be opportunities for students if they need mental health services or any services that will address their well-being will be available to students as well. So we're still going to operate. We're still going to do what we can for students and make sure that they're well and ready to be successful throughout the remainder of the semester as we prepare for the spring. The next question is also for me. I read that nearly all CU suspensions this semester were COVID related. Can you say more about that? And though it has been listed on our dashboard, those are the things we wanted to make aware that we are making sure that our enforcement efforts are posted around large social gatherings. As Jeff mentioned earlier, those were the things that caused the spike back in September. So we wanted to really ramp up our efforts to make sure that students understood the seriousness of large social gatherings, parties, and we wanted to make sure that students were deterred from participating in such actions. This next question is for Pat. Will you have testing available between Thanksgiving and the return to school?
Yes, absolutely. All of our testing sites are going to remain open. Well, I shouldn't say all of them, but We will be posting the hours and schedule for testing that will be available for students, faculty, and staff all through December and before the spring semester gets going. That will remain in place continuously.
Thank you, Pat. This next question is for you, Russ. One of the big selling points for my student was the cohort plan. Would you provide an update on the cohorts that first-year students were assigned to this fall? Also, are there plans to readdress implementing cohorts in the spring? Russ?
Yes, so thank you for that, JB. With respect to the cohorting that we put together at the beginning of fall semester, that will have to be redone in spring for the simple reason that a number of students are changing their living situations, which would actually disrupt existing cohorts. That said, once people are assigned to living quarters, there'll certainly be living cohorts put together. More importantly, what we're planning, and we've learned a whole lot this fall, unfortunately in these situations, you have to learn every day. We're making plans to provide more safe in-person activities for our students in the spring. Through that, we hope that there'll be creation of social cohorts moving forward. But we really are focusing on improving that social side of the student experience for the spring semester.
Thank you, Russ. And Russ, I think I'm gonna stay with you on this next one, and maybe Pat, you could jump in. How is CU engaging students in creating events and options such as distancing in circles in outdoor spaces like Folsom or Fair and Fields? And can these spaces be used for learning activities and not just for sports and recreation?
I'll take a first crack at that one. Yes, so what we've been working not only with our student affairs colleagues, but with our faculty and staff on creating more safe opportunities, many of which might be outdoors. Hopefully we'll have a mild winter that will allow us to do that. But we do believe that we can deploy some safer activities, all contingent though, on guidance that we're getting from Boulder County Public Health and the state. And again, this gets back to the mode of operations being pegged to the state dial and the COVID situation on the ground. Pat, I don't know if you want to add anything.
Only that we have been doing focus groups and other activities to try to get a pulse on what the students would value coming into the spring semester. Dr. Bradley and JB and your team, I know, are working all the time to try to think about what are those things that can be both meaningful and safe as we return in the spring semester. And so using those outdoor spaces wisely once the weather permits us to do it will be part of the strategy going forward.
Absolutely. This next question is, Pat, I'll keep you here and we'll tackle this next question. For the students that have tested positive and have been in quarantine, have you surveyed them to ensure that all the practices you implemented for their quarantine experience has been consistent? What, if any, gaps have you identified, and what steps are you taking to address them? And I know Jennifer might be around as well, but I'll let you take a stab at it, Pat.
So we have done surveying about the experience that students have had. And we are already making some adjustments to be able to make sure that if we have students who continue to need that isolation and quarantine space coming into the spring, that we're providing the right level of support. What we've realized is that includes not just making sure that the health needs of the students are being met, but also to make sure that their mental and emotional needs are also being met. We are going to be providing more support for students who are going to be in that isolation and quarantine space. We're doing some hiring to be able to have a director who can come in and be able to work within that environment. And the chancellor recently announced that he was making some additional investments investments in mental health resources across the campus, which will allow our ability to make sure that we're meeting the needs of the students who are in that environment.
Thank you very much, Pat. And I'm going to go to Russ, and then Pat, you may jump in on this next question. When will you be able to say something more definitive about any changes to the start of the spring semester, given the current rise in cases in Boulder County and Colorado?
So once again, this will be largely dependent on the status of the state dial and how we peg our modes of operation to that dial. To the absolute honest answer is, as we approach the beginning of a spring semester, while we intend to operate by providing in-person experiences for our students and blended with remote experiences, again, we are somewhat at the mercy of the status of COVID on the ground around us and pegging to the dial. As soon as we actually have any definitive information on that or projections in terms of what the state would, the state of the state would be in mid-January when we come back, then we would make a decision as soon as possible to allow people to plan accordingly.
And I'll jump in on that as well, which is that we anticipate that there will be additional guidance coming from the state. As I mentioned earlier, Governor Polis is having a press conference today to be able to talk about measures that the state is going to be taking to address the sharp rise in COVID cases. But here's what we do know, which is, as Jeff Zayak told us earlier, the numbers in Boulder County are very far into what would have been the red category, at almost 750 cases per 100,000 people. For us to be able to be sure that we're going to be able to offer the type of uninterrupted educational opportunities, better social interaction, all of the things that we want to do to support that student experience, we've got to start bending that curve down now. If we don't start bending that curve down now, it's unrealistic to think that we're going to be able to start bending it down in January. And so for all of our students and the parents and the faculty and others who are listening, this is the time when we really have a chance to make a difference, because if we don't start doing it now, those rates of infection, they rise quickly, they drop slowly. And so if we want to get back below that benchmark metric of 350 cases per 100,000 people, we've really got to get to work on it quickly. And we know from past experience, given the bump that we saw in the 18 to 22-year-old population in September and early October, that our students and our community can bend the curve. But you got to do the right things, even though it's hard. And it's going to be hard during the holiday season, but that will give us the ability to be able to communicate how we plan on being able to deliver instruction successfully in the spring, the quicker we can get to work on it.
Thank you very much, Pat. This question is for us. What are you hearing from Russ. Are there specific efforts CU Boulder is taking to support international students? Russ?
Yes, there are. Our Office of International Student and Scholar Services, we call it ISSS, is actively involved in supporting our international students, understanding that they're dealing both with COVID and changes to visa and travel requirements. So that's another added layer of stress for our international students. So ISSS is working with our students in a variety of ways. This includes expanded advising hours to serve students who are in various time zones, sometimes halfway around the globe, and providing assistance in helping students apply for emergency student fund grants from the Institute of International Education. Similarly, ISSS is offering a number of community building virtual events for our international students, including, for example, trivia nights and Buffs Around the World events, and many more. So we're actively engaged with trying to support our international students in a variety of ways. And I think ISSS, if anyone has questions, please go directly to them and they can provide you more detailed resources.
Thank you, Russ. This next question is for me, 2 questions related to housing. When will housing requests open for January? We were originally told November 1st. What date will move-in appointments for January be available, or when will they be available? And I want to make sure that you are aware that on our housing and residence website, you can find that information. On January 10th, we will have opportunities to move in. New arrivals will be from January 11th through the 13th. We are trying to determine some final things around appointments and is related to testing. Once we determine that, we will certainly communicate that out to the students at that time. This next question is for Russ, myself, or Jennifer. My freshman engineering son has been trying hard academically and socially, but last night told us he is miserable. He hates remote learning. His advisor is only somewhat helpful. I know there are resources such as the engineering first-year coordinator, but he can't seem to take the next step to get more help. We parents are trying not to make the phone calls for him. Thank you for any concrete suggestions that are available now. Russ, I'll let you take the first crack at that. I'll come up right behind you.
Yeah, thank you. So in terms of academic progress, I would encourage the student to attend previously scheduled office hours with faculty members. Faculty really do want to help students succeed academically. Also, directly contact faculty members or TAs to let folks know that a little extra tutoring or help might be required along the way. I'm sorry to hear about the lack of satisfaction with the advisor, but offline, maybe we could connect on that and we could provide a better experience for your student. We also have resources that are available for the student, and JB, I'm going to kick this one over to you and or Jennifer, but our CAPS operation is absolutely superb. And I encourage your student to reach out to our psychological services operation to get the help and support that he or she may need.
And I'll add to that, Russ, thank you. That is certainly a great suggestion. Also, I would suggest that they get involved with our student support case management. If they're not involved and if they want to be involved in clubs or organizations, certainly they can reach out to me and I can make sure that they are connected. Just recently started what's called the Dean of Students Leadership and Values Council. And that is a council of students who are informing me about issues, opportunities, et cetera. Certainly I would want your student to be involved in some of those activities as well. They can reach out to the Dean of Students at colorado.edu. I'd be happy to follow up and visit and point them in the right direction.
Just one follow-up too. It's important for the parent to let the student know that he's not alone. There's been students who have struggled throughout the course of the semester. It's been challenging in a lot of different ways, and some students have struggled with remote learning. It's important for that student to know that he really is a valued member of the campus community. And our CAPS program and SSCM, please reach out, make an appointment. We want to be there to be able to support and understand the experience that they're going through. So a lot of those students are feeling isolated and struggling from that feeling that they are alone. We need to make sure that we let them know that they're a valued part of the community and that we're here to support.
Thank you, Pat, for that point. This next question, again, is for you, Pat. First of all, thanks everyone on the call for your updates and hard work this semester. Will the rec center remain open for the rest of the semester?
So That is something that currently I would say, yes, we've had that on a limited basis. It's appointment, but we're going to remain open as long as we can. As I said before, we don't know whether or not there's going to be other orders from the public health authorities that might affect that. But so long as we have the ability to be able to safely operate the rec center, we intend to do so because we know what an important outlet that is for the people who use it.
Pat, if I can, I would just reinforce relating it to the dial, which we didn't have early in the semester, but we do have now, and certainly the dial will be updated. And that would, if parents and students, faculty and staff could look at the dial, that would give some indication about some of these areas being open or not open. I believe that will be a valuable tool for all of us as we move forward.
Thank you, Chancellor. Pat, we're going to stay right with you on this next question. Thank you all for your time and work throughout the entire semester. These COVID updates have been extremely helpful. I'm wondering if CU staff can get a PCR saliva test on campus, or can they just get the nasal test?
So, Jennifer, jump in and correct me if I'm wrong. The first thing I want to do is actually thank the person for tuning in and to be able to say that it's been really our privilege to be able to do these updates throughout the course of the semester. And we've learned a lot about the need to be available and here to answer questions. And so we're going to keep doing that and make that part of our framework for how we communicate going forward. The short answer to the specific question, though, is that we have opened up saliva-based PCR testing for all faculty and staff at CU, and anyone with a Buff1 card can get an RT-PCR surveillance test. So please come in and get those.
Thank you, Pat. And again, we're going to stay with you again on this next question as well. Will testing be available for off-campus students who will leave in December after finals are over?
Can you give me that one more time, JB?
Sure. Will testing be available for off-campus students who will leave in December after finals are over?
So anyone who is student, faculty, or staff who remains in the Boulder community will have that surveillance testing available to them all throughout that winter break. If students leave the Boulder community and need to get tested at that point in time, they should work with the community resources available in that community. But we'll keep our campus-based testing operation going continuously.
Thank you, Pat. And this next question, we're going to go to you, Jeff. Are ventilators still being used in Boulder County for COVID patients? Nearly 90% of New York patients put on ventilators died, and I read they were no longer the standard of care. What are the most effective therapeutics being used at Boulder hospitals? So actually, two-part question, Jeff. If you need me to repeat any of it, I'm happy to do that.
No, I can answer that. And I did answer part of that in writing. I don't know the answer to the second question. That would be best directed to hospitals. But the first part of the question is exactly correct. What hospitals have learned over the time that this virus has spread is they've learned how to do better treatments on people that end up in the hospital. So there's recent data that shows that the length of stay by not putting somebody immediately on a ventilator, which is what hospitals were doing early on in the disease because they didn't know how they were gonna how to handle it, is that has improved treatment and shortened the length of stay for hospitalizations. But they still do use vents for people who are on COVID. And I don't know what standard is applied as to when they would do that or not. And that again does become a challenge for somebody who's in a really serious place. If they're putting somebody on a ventilator, it's because they're in a really difficult place and they don't know if that person is going to be able to continue to live or not. And if we get into a crisis standards of care, I just use ventilators as an example, but there's many examples in terms of care that has to be administered in hospitals that have to be then made. Choices have to be made when hospitals are overwhelmed. They can have serious impacts, including death on people.
Thank you very much, Jeff. This next question is for you, Chancellor. Is there a strong commitment to try to continue in-person education next semester? This is so vital for so many students. Chancellor.
Thank you, JB. And yes, there is a commitment to provide more in-person teaching and learning. In fact, right now, I believe we have over 2,000 courses scheduled for spring semester that will be in person. And many faculty from the fall who were teaching remote want to teach in person. So again, we know that in-person teaching learning is so important to our students and our faculty. But as we said earlier, the state DAO will be a factor in determining in-person versus remote. But certainly that is a commitment on our part, is to offer more in-person classes in the spring.
JB, just to follow up on that, which is, this is a time to be able to recognize the real partnership that Boulder County Health had with us throughout the course of the fall semester. There were times when we had increases in disease and other times when they could have stepped in different ways. They've always been very supportive of us trying to make sure that we're providing the best educational, best social, and other opportunities. So I don't want it to feel like that the public health officials are the ones who are somehow preventing us from being able to continue instruction. They've been really valued partners in terms of our ability to make sure that we're continuing to do in-person education and doing it safely. And we're going to continue to work with them and with the state to try to be able to make sure that happens.
Thank you again for that. This question is for Jeff, and I'm going to also ask Pat and Russ, maybe you can join in on this, and we can all tackle it. As a student, I know that me and thousands of my peers have felt poorly represented and unfairly marginalized by many of the public health orders this semester. How can students know that their voices have been heard? Jeff, you want to start, and then we'll all jump in.
Yes, yeah, I'm happy to. Thank you very much for the question. And the first thing I want to say is it is definitely sad to hear that you're being targeted and that there's so much stigmatization. That does make me very sad. I have definitely listened to feedback. I can tell you that after the first couple of weeks of doing this, I had probably received over 100 phone calls from students and saying specifically that they really want me to know that there is many people doing the right thing. And I pretty quickly and immediately adjusted my language when I was doing these to recognize that the majority of our students are doing exactly what they need to be doing to reduce this spread. Unfortunately, even today, we still have students that are demonstrating behaviors that are not only illegal, but they're unhealthy for keeping our community where we need to, keeping all students in school. And we know it's a challenge as recently as this last weekend. So it's a really difficult issue to tackle. And I think that students, obviously, who are doing the right thing, I so much appreciate it, because that is the direction that we need to head. And we can't let up on students that continue to put our community at risk, we have more deaths in our community now. The reason that we put those orders in place were specifically because of the data that we were seeing. And we know that a combination of the orders and student behaviors made the difference as to why we are where we are today, which is we brought that significant 18 to 22-year-old rate down. And we've really tried to work with students. We've reached out to students on the Hill. We've helped make sure that we were providing education and support to the fraternities and sororities, and we've worked really closely with the university to figure out the best way to get messages out. I am, again, sad to hear that students who are doing the right thing are being targeted and stigmatized, because that was never the intention.
I'll follow up a little bit with what Jeff said, and also follow up on something that Pat brought up. The vast majority of our students are really doing a wonderful job. And when we saw the outbreak some time ago, the rapidity with which we actually bent the curve back down was just a tribute to our student population. Again, the vast majority of whom are exhibiting the best behaviors. Through that, we did hear voices, because sometimes to bend these curves requires a sort of a blunt response, which unfairly punishes students who are behaving in the first place. But we've heard voices from students that have allowed us to work with our student affair partners, our county, Boulder PD, CUPD, to try to provide safe opportunities for our students, including, for example, more recreational opportunities. I know that was particularly trying for students during the last outbreak that we had, but we've tried to be as responsive as possible and learn from these responses so that we can have a better experience for students should this happen again.
The only other thing that I would add, JB, is I'm sorry to hear from the student who wrote in that they didn't feel like that the student voice was well represented. The county and the city actually took what I thought was a fairly extraordinary step, in that they invited us to be part of the command set decision-making structure in response to COVID. There was nothing that required them to do that. And when we brought to them concerns about how things are affecting the student population, uniformly, they've been receptive. The job of the public health authorities, though, isn't necessarily to say what CU wants to do, but to be able to address infection in the community. But I can guarantee that your voices have been heard, that the public health authorities want to be able to make sure that education is continuing, and that the intent was not to demonize the 18 to 22-year-old population, but instead was to try to protect the campus and the community.
Thank you, Pat. And I think I'll stay right here with you on this next question. As the risk manager for Phi Delta Theta, I've been tasked with managing the spread of COVID throughout our fraternity and our 33-person house. Recently, I have been advising members to go to the surveillance testing sites on campus for weekly monitoring tests. But surveillance sites are understaffed, and we don't always get results in a timely manner. What can you do to help us monitor our student members?
So I'm sorry to hear that. I have not heard questions before about the staffing on the surveillance sites. I will check in with Jennifer McDuffie and others. All of our members of our campus community have had testing available since early October, and that includes members of the Greek system. We know that we still have capacity that is not fully being utilized for that testing. And so we'll make sure that the staffing allows that to take place.
Thank you, Pat. And this last and final question is for our Chancellor. Chancellor, has the pandemic been so devastating to CU Boulder's operations that you are anticipating increases in fees, tuition, and other revenue areas in the near term to compensate? Chancellor?
Thank you, JB. And to just keep in mind that we've not had a tuition increase in the last 3 years. We still have our guaranteed tuition. And for spring semester, there will be no increase in tuition nor in fees. We will be presenting a budget later in the spring to the Board of Regents for fall of 21. But at this point, for spring semester, there will not be any increase in tuition or fees.
Thank you, Chancellor. And as I close, thank you all for calling in today. Please note, this is our last webinar of this weekly series. There may be more. As needed, we will host a webinar to update student, staff, faculty, staff on critical developments, and we will announce that webinars through all our CU news and social channels. We also plan to continue these webinars as part of our return to spring semester. So stay tuned for announcements of timing and scheduling for these. If you have questions or would like to see additional information, you can do so by visiting our COVID-19 website at www.colorado.edu/COVID-19. There's a chat at the bottom. There's a who to contact box at the lower left on the page with an ask a question box. We'll now end the call. Thank you for joining, and as always, go Buffs.